Hello everyone! Today we're going to present our research on the psychological and the social impact of HIV. Let's start with the explanation of what HIV is. HIV attacks the immune system, especially CD4 lymphocytes, which are the cells responsible for protecting us from infections. The virus is mainly transmitted through unprotected sexual intercourse, infected blood, for example through shared needles, and from mother to child during pregnancy, delivery, or breastfeeding. But HIV is not just a physical illness, it also has deep emotional and psychological consequences, which was the focus of our research. Our goal was to explore how a diagnosis of HIV affects a person's mental health, quality of life, and social relationships.
To understand this issue better, we conduct a systematic search on PubMed, one of the most trusted databases for medical and psychological studies. At first, we searched the HIV diagnosis and psychological impact and social stigma without any filters and got 107 results, but many were not relevant to our topic. So we started adding filters. Within the last 10 years, we narrowed the results down to 69. Then we added the free full text option and we had 40 articles. Finally, applying 5 specific filters, which are clinical trial, randomized controlled trial, and systematic review, we were left with just 6 high-quality articles that were directly related to the psychological impact of HIV. We summarized the results in a table to organize the information more clearly. This helped us identify the most common psychological symptoms, the most affected group, and the social consequences of living with HIV.
From our analysis, we found that HIV has a major impact on individuals. There is a high incidence of depression, anxiety, post-traumatic stress disorder, and substance abuse among people diagnosed with HIV. Chronic pain was also very common. Up to 83% of patients reported it, especially adolescents, women, and people in the LGBTQ community. Another key finding was the fear of stigma. Many people are afraid to reveal their HIV status, which makes their mental health worse and makes it harder for them to follow treatment. On a societal level, about 20% of HIV-positive individuals do not reach viral suppression, which makes it harder to control the epidemic. Mental health is not just a personal issue, it also affects public health because emotional distress can reduce treatment success and increase transmission rates.
Some populations are particularly vulnerable to psychological and social effects of HIV. These include transgender people, pregnant women, and adults living in poverty. They often have less access to healthcare and face more discrimination, which increases psychological stress. Our research showed that mental health and HIV treatment are deeply connected. One cannot succeed without the other. However, the studies also had some limitations. It's difficult to compare data from different countries due to differences in healthcare systems, social stigma, and economic conditions. In conclusion, we discovered that HIV is not only a medical issue, it's also a psychological and social challenge. To truly fight HIV, it's essential to include psychological support in treatment plans and do more research focused on the most vulnerable groups.